One of the biggest and most well-known popular Medicare carriers in Los Angeles is Blue Shield. And as a result, we oftentimes get a lot of questions about what Blue Shield plans are available once somebody reaches Medicare. So today we're going to be talking about 3 of the Medicare Blue Shield options we discussed with our clients most in Los Angeles in 2025. Hi, I'm Michael, and this is Michael's Medicare. And if you or somebody you know has questions about their Medicare health plans options, please feel free to reach out to us at the information down below, and me or somebody from my team will be happy to assist them in person or over the phone at one of our many offices across Southern California in English or Espanol. Also, don't forget to like and subscribe. Blue Shield and maybe just a handful of other carriers are about as close to a household name that one could get in the insurance world. This means that they are one of the plans we get asked about the most. And luckily, they really do have a wide variety of plans that are available for the general Medicare community, some that specialize in specific areas like for folks who have eligibility for Medicare and Medicaid, as well as some that focus on being the most cost effective. So since we are doing an all Los Angeles Blue Shield plans trifecta, let's start off with a plan that is really only available in Los Angeles and some parts of Orange County, which is the Blue Shield Inspire plan. Now, we won't go through all the benefits because there are a lot, but really we will talk about mainly the few of those benefits that really stick out that makes these plans different from their other Blue Shield kin. First and foremost, and most notable, is going to be the fact that it has a very, very low maximum out of pocket, or MOOP, of $599 a year. Now, what this is the total amount of money that a Medicare beneficiary who's enrolled can pay for their Medicare covered services, meaning things like hospital coverage, doctor's visits, as well as specialist visits, but not including things like prescription medications that are going to have its own separate limit. But $599, that is on the pretty much medium rare side as far as maximum out-of-pockets or MOOPs go in 2025. So it's a pretty good start. For doctor's visits, the cost to go see both primary care as well as specialists, those are set at $0 for either, which is a number that most people would like to see. I know I sure do. And then there's going to be some very basic dental that is automatically available for basic things, as well as a $16 a month dental buy-up option that will be a more comprehensive dental that includes those expensive teeth things like crowns and dentures and things like that. Overall, the Blue Shield Inspire Medicare Advantage is one of those new additions to the Blue Shield families that is a good fit for those folks who really want to put a cap on their overall potential yearly Medicare costs and are strongly going to be budget-minded when examining their Medicare health plan options. Next up, let's talk about a Blue Shield plan available in Los Angeles in 2025. That is one of the most common plans we specifically enroll folks into, which is the Blue Shield Total Dual plan. Now, as we look at this plan, most noticeably upfront is going to be the fact that the benefits have a cost of $0. And there is not a monthly premium, nor is there an out-of-pocket maximum, essentially meaning that for almost all of the costs of all the services that one could get when they are covered under this plan on Medicare, it's a $0 cost. Now, you might ask, well, how does that work? Because it is the Blue Shield Total Dual plan. It is the Blue Shield Medi option, meaning that it is a plan specifically designed for folks who have both Medicare as well as Medi-Cal eligibility for low income. This also means that because Medi-Cal is helping pay for the services, all the beneficiary sees when they utilize those services is $0. So that's one side of it, but on the other side, and more important to mention, is that there are additional extra benefits that come along with choosing a Medicare Medi plan. One of the most useful, I would say, is actually the grocery allowance that will provide a $50 budget per month for enrolled beneficiaries to buy healthy, nutritious food. I know that one is a big help, especially for our Medi clients. Additionally, there is an over-the-counter allowance of $70 a month, and this is a separate budget that folks can use to order things from the Blue Shield catalog that they would normally buy at the pharmacy, but doesn't require a prescription. So think things like toothpaste, bandages, blood pressure monitor cuffs, and even some home safety equipment like those bathroom mats or the handles as well. And lastly, a very nice benefit is the automatically included comprehensive dental benefits that are available on the plan at no additional cost, and they do not have a yearly limit on the amount of benefits that someone can use, unlike the dental benefits that are available on just the normal standard run-of-the-mill Medi-Cal dental, or Denti-Cal, which do have limits on those services. Last up for today for the Blue Shield plans in Los Angeles is going to be one of the longest running Blue Shield plans available, which is going to be the Blue Shield Advantage Optimum plan. Now, being one of the longest surviving Blue Shield Medicare plans means that when we look at the Blue Shield Advantage Optimum, the copays are still sort of stuck back into the 2000s, like that studded belt that kids are wearing nowadays. It's meaning that you won't see the zeros across the board, or really the eye-popping extra benefits like the grocery benefits, but what it does have is reasonable copays and costs, which we'll look at, but also probably one of the best Blue Shield doctors networks available. Because yes, each of these plans on Blue Shield are Blue Shield plans, but no, not all of them have the exact same doctors, networks, and hospitals that are covered. And the Blue Shield Advantage Optimum plan has some of those hospital networks that folks in Los Angeles love. Networks like Cedars-Sinai, Hoag Medical Group, Providence, or Memorial Care, and a whole lot more. So when we talk about benefits that may seem a little bit more costly, just remember, these plans will allow access to some of those doctors networks who we would say are maybe a little more finicky about which plans they actually accept. That being said, it doesn't have a monthly premium, and there is still a $0 copay for normal standard doctor's visits, but a slight copay of $5 to go see a specialist. Additionally, is going to have one of the highest maximum out-of-pockets in the market at $2,900, and its dental benefits are going to be limited to the more basic, let's call it routine coverage, unless of course you buy up to the PPO or the HMO dental complete coverages. But you know, the doctors networks, oh man, they are good, and that is one of the best things about it. And if that's what you're going for, you're gonna pay a little bit more for it, but you're gonna get to keep a lot of the doctors that you may not get to keep on any other plan. All right, so there you have it. Those are the 3 top Blue Shield plans that we see folks asking for in Los Angeles most in 2025. That is the Blue Shield Inspire, which is for those folks who want a lot of benefits and at a very low cost and don't have the most specific doctors networks needs. The Blue Shield Total Dual, which is a good option for those folks who have both Medicare and Medi-Cal eligibility and want some of those really interesting extra benefits. And the Blue Shield Advantage Optimum, which isn't going to be the lowest cost benefits, but it's going to have one of the most comprehensive doctors networks within the Blue Shield Medicare Health Plan portfolio. So I really hope you enjoyed this video, and if you or somebody you know has questions about these Blue Shield plans, or really any of the Medicare health plans available around there, please feel free to reach out to us at the information down below, and either me or somebody from my team will be happy to assist them in person or over the phone at one of our many offices across Southern California in English or Espanol. So for Michael's Medicare, I of course am Michael, hoping that you all have a great rest of your day, and goodbye.